shacbiga weydin doonaya wakilaatihiin danta guud wado wakas kawntigi ad wanaajiseen wakilaatihiin danta guud wado wakas kawntigi ad wanaajiseen jecliyaye mandheera jawigeeda degan jecliyaye mandheera gabdhaheeda jaraqsan jecliyaye midadka dhaji baxay kawntiga jecliyaye mandheera gabdhaheeda jaraqsan jecliyaye midadka dhaji baxay kawntiga jecliyaye mandheera gabdhaheeda jaraqsan jecliyaye midadka dhaji baxay kawntiga jecliyaye mandheera gabdhaheeda jaraqsan jecliyaye midadka dhaji baxay kawntiga.
Thank you very much. The Governor, Mandera County, His Excellency Mohammed Adan Khalif, the Deputy Governor, members of Parliament present, and honestly, I'm happy that you all made it. And it is thanks to the Governor's efforts. Asanteni sana. Members of the County Assembly of Mandera, led by your Majority Leader, officials from the County Government of Mandera, my colleagues from the Ministry, and especially those from KTTA, distinguished guests, ladies and gentlemen, good afternoon. Assalamu alaikum. Asante. I bring you greetings from the President, His Excellency Dr. William Samoei Ruto. Mumepokea? Mumepokea salamu za rais? It gives me great pleasure to join you here in Mandera as we officially open the Mandera Referral Hospital Satellite Blood Bank and also to launch the Health Task Force report and hongera to Mandera County. Your Excellency, you wouldn't have gotten a better chair to midwife and deliver such a report than Professor. Asante, Professor. There are very few men in this country who can speak straight to the truth. And sitting here and listening to him, he is one of them. And Professor, among the wise men that I've been looking for to help me steer the ministry, you have earned your place in that list. Earlier this year, Governor Mohammed Adan Khalif paid me a courtesy call at Afya House. It was a late evening call, and we held discussions regarding the health status of this county. And I also told him about my priority areas in delivering universal health care. Today, I'm here to honor his invitation, which he had come to invite me to launch the task force. And I told him, that is too small for the CS. Can you look for other projects? And from that discussion is when we agreed that we have to ensure the equipment for the blood bank is here so that we launch it today. As we all know, universal health coverage is one of the priority agenda for Kenya Kwanza government and specifically His Excellency the President. Universal health coverage seeks to ensure that all individuals and communities in whichever part of this country have access to safe, effective, quality essential services without suffering catastrophic expenditure. This is based on the principle that everyone, regardless of their social status, income, should be able to access health care they need without their economic status. So indeed, I want to identify myself with a tagline from this task force of identifying, reaching, and serving with dignity. Ladies and gentlemen, allow me to recognize your governor And for instance, I take note that the maternal mortality ratio has reduced from a high of over 3,000 per 100,000 live births in 2013 to 384 deaths per 100,000 live births in 2022. This is good progress, but it's not the best. There's still a journey, Governor. Ladies and gentlemen, my ministry is committed to supporting county governments in strengthening their primary health care services while also building capacity for specialized care, including critical care, renal and cancer services. One essential health service that forms a basis for quality health is the availability of blood. Today, my ministry, through the Kenya Tissue and Transplant Authority, has facilitated this satellite blood bank center in Mandera County that we launched today. Mandera County serves a population of over 800,000, and according to WHO standards, it should be able to process 80,700 units of blood annually. Whereas this was not possible before, I am confident that going forward, this is going to be achievable through the initiative that we have launched today. This is a significant milestone in improving access to safe and quality blood transfusion services in this region, and thanks to the efforts put in by all of us collectively and collaboratively. Ladies and gentlemen, I would like to appreciate all the concerted efforts and collaboration that ensured the successful setup of this blood bank. The launch today contributes to my annual target of achieving 400,000 units of blood bank collected and distributed by June 2023. We are on track towards achieving this target, and I thank you all for your efforts. Through the KTTA, my ministry will continue supporting counties by providing blood bags, testing reagents, among other necessities. In addition, we'll continuously monitor and evaluate blood establishments countrywide to ensure that safe and quality blood is readily available to all Kenyans who need it. Ladies and gentlemen, blood, unlike any other medical consumable and needs, cannot be procured or purchased through the normal way. I would like to implore and urge the residents of Mandera to develop a culture of blood donation. And I'm happy today we saw 3 gentlemen who are donating blood. Blood donation is a noble act that can save lives. This culture will ensure you provide adequate stock levels at the blood bank in the new center that we launched. We need you residents of Mandera, and especially the youth who form a majority of healthy population and thus qualify to be voluntary regular blood donors, to step up and donate blood. Looking across the room, I can see many of you here meet this basic minimum criteria to donate blood. I see almost everyone here could be weighing over 50 kilos. And the ages are 16 to 65, and those are the minimum criteria. And the faces are beaming with radiance, and you all look healthy. So you can donate blood.